Thanks so much. It's a pleasure to be here with such distinguished speakers, and I'm delighted to share some of the results of our study with you all today. So I've got a lot to get through, so I'll go quickly. So just want to initially thank all the co-authors on this study, none of whom are here today. So as many of you here in the room know, alcohol health warning labels can be effective in influencing the population's consumption of alcohol, in promoting better understanding of the health harms related to alcohol, and to making the population more supportive of other alcohol control interventions or policies. As part of the Public Health Alcohol Act 2018, Section 12 provides for alcohol health warning labels on all alcohol containers in the country. And this is what they will look like. They'll be quite detailed. We won't go into the exact details of it now, but that is what they will look like. And they'll be world leading in a lot of ways. As Ireland is an EU member state and part of the single market, we had an obligation to refer our draft regulations in relation to health warning labels to the European Commission. And as part of that process, member states could weigh in on whether it was compliant with EU single market laws and other EU laws, and also other interested actors such as the alcohol industry. So the alcohol industry, unsurprisingly, did weigh in on whether on these draft regulations, and their submissions to this process are what we analysed as part of this study to show how they are framing the debate on alcohol health warning labels. So very briefly, we took these 16 submissions to the European Commission. We analysed them, did framing analysis on them, and I'll jump straight into the results now. So as I said, there were 16 submitters. These were all of them there. They're almost all alcohol trade associations. And unsurprisingly, they all opposed alcohol health warning labels and were urging the European Commission to block the legislation from going through. And most of their arguments fell under these four main themes, which I'll go into now. So firstly, the first theme was that they argued about the lack of evidence to support alcohol health warning labels. So firstly, many of them argue that there's no unequivocal link between alcohol and cancer, saying that the science is not settled, we can't say this for sure, we can't put this on a warning label. They also had some other overlapping arguments saying that the link between alcohol and disease is complex, or that there are many causes of cancer in particular. So cancer is a very complex disease. It's multifactorial. We cannot pin it down. We cannot say alcohol is a cause. You can't put this on a label. So that was one of the main arguments they put forward. And they're also very keen to dichotomize between responsible drinking and problematic drinking, and saying that these health warning labels really only relate to problematic drinking, and therefore to put them for everyone, for people who drink in moderation, this is wrong because it's not unhealthy to do that. Another facet of their argument was that there's no evidence to support the use of labels in general, that they're weak intervention, that they're stigmatizing, they're alarmist, they misinform the public, they mislead the public, and so on. They also spoke a lot about the negative trade and economic implications of introducing alcohol health warning labels. So they said that if Ireland was to have its own unique bespoke label on all alcohol containers, this would represent a barrier to trade for other EU member states importing alcohol into Ireland, and also to other countries outside of the EU. And that because they breach single market laws, that's obviously a barrier to trade, but they also do not warrant a grounds for an exemption on public health grounds because the science is so unsettled and so uncertain. They also spoke about how introducing alcohol warning labels will introduce a lot of cost to the industry. It's very expensive to have these unique alcohol labels, and that's unfair to the industry. As a result, small and medium alcohol producers will be disproportionately affected by this measure. And they also talked about how Ireland should consider less disruptive measures, such as mass media campaigns. They're also keen to promote digital labelling as well. The third theme was that they spoke about the risk that the alcohol health warning labels pose to EU governance. So many of the submitters argued that the EU already plans to legislate for alcohol health warning labels, and for Ireland to go off unilaterally to do this would undermine those efforts. They also then argued that this also should be something that's legislated for at the EU level, because it's something that should be harmonised. EU citizens deserve to be equally informed about the health harms of alcohol. It's not fair that Irish people are so informed and others aren't. So that was one of their as part of their kitchen sink approach. And then the final theme was that they were demonstrating their commitment to public health. So nearly all of the submissions started with the trade association talking about how proud they were to work with governments or NGOs, or to start these voluntary initiatives or donate money. And they're also keen to show their support for alcohol warning labels in certain circumstances, specifically in pregnancy, drink driving, underage drinking, and then also for this problematic drinking. And also they wanted to emphasize their support for the policy alternatives such as digital labeling. So as a whistle stop tour, I need to take a breath. So in summary, a lot of the health arguments were quite unsophisticated. They weren't really citing a lot of the evidence. They weren't citing, most of them didn't cite any scientific journal articles at all. Many of them cited industry-funded journal articles or ones from decades ago. And a lot of their arguments are clearly wrong and can be easily disputed. They also were very keen to emphasize the trade arguments, which obviously makes sense. The EU was set up originally as a trade organization. It doesn't have a very strong health competence. They know their audience. It was also notable how much they were keen to promote digital labeling. And there's not a huge amount of evidence supporting digital labeling, but from the limited evidence we have so far, it's much less effective than actually having a label on the container. So this study has been really important. It is important because it draws back the curtain on what the alcohol industry is saying about this relatively new initiative. As we know, the European Commission did not block these regulations. They will be introduced in May 2026, but that's only the beginning. We've won this battle, but we know in the future we'll need more warning labels. We'll need big warning labels. We'll need rotating messages. We can't just keep one there. So we need to anticipate their arguments and be ready to mount our own counter lobbying efforts. So happy to take any questions.